Hello, welcome back to my channel. Today we are going to talk about how treatment of alopecia or baldness, hair loss, can cause problems in sexual health. We're going to explore what medications can contribute to that, what are the symptoms, and why doctors who prescribe these medications fail to warn their patients. As a psychosexual therapist, what I noticed is that there is a pattern from male clients who inquire about problems related to erectile function issues. And when I ask clients to fill in forms regarding medications, what I noticed is that there is a pattern of men who've been prescribed medications to treat hair loss, that they have different types of erectile function issues. The interesting thing is that when I speak to these clients about that, some of them would say, oh no, I don't think it's relevant because I had these problems, sexual function problems for a long time. It's just when I started taking this medication, I noticed it's gone a bit worse. There is another reply like, oh no, but I've stopped taking these medications like a while ago, but I still have these problems. So I delved into more deeper research myself about these medications, and when I found out this information, I thought I have to record this video and put it out there for people to be aware of these things. The most common drugs that are prescribed in the UK to treat hair loss in men are finasteride, dutasteride, and also minoxidil. And when I looked at the research, it actually says that for many years these drugs have been used successfully to treat hair loss. However, there is a pattern noticed by other specialists that people who take these drugs for a long time develop unwanted side effects. And the side effects can be psychological problems, sexual function issues, and also physiological problems. So there is a term called Post-Finasteride Syndrome. This is a condition of developing unwanted mixed symptoms of different kinds as a result of taking finasteride. And these symptoms can continue even after stopping taking this medication. So symptoms can be sexual function issues of different types, erectile dysfunction, premature ejaculation, lack of libido, and also infertility. Psychological problems, increased level of anxiety, overwhelming, catastrophizing thoughts, high level of stress, paranoia, and also physiological problems like problems with skin or problems with metabolism. Finasteride is a medication that is used to treat hair loss as well as enlargement of prostate. And the way it works, it blocks enzyme that stops conversion of testosterone into DHT or dihydrotestosterone, the hormone that is responsible for hair loss and for prostate enlargement. So when the levels of this hormone are lowered, then it has a positive effect on hair loss or hair regrowth and also problems related to prostate. However, it's been noticed throughout years that as a post-effect of taking these medications, a lot of people complain about problems with their sexual health. And research has been done and is still going, and concerns are still there, but there is not enough medical evidence or scientific evidence, for whatever reason, to say that these drugs are very damaging for male health. Finasteride is not officially approved for women. However, in some cases, it is prescribed for women to treat hair loss or, to the contrary, to deal with too much male hormone in female system. But this medication is not approved for pregnant women. And again, there was an evidence that even those women who've been taking this medication, again, the size of evidence is not big enough to prove that this medication is damaging, because the number of women who were taking it is significantly less. But still, even that fraction of number complained about side effects like irregular periods, like loss of sexual drive, and also headaches. So men who've been taking these drugs, they complain that they have problems with erection, premature ejaculation, also problems with libido, sexual drive. And it's quite hard to track the link between these problems and taking of these drugs, because in some cases men say that he had problems before even knowing about the existence of this drug. And then when he started taking this drug, he noticed that his symptoms became worse. Some men say, oh, I've stopped taking this drug a long time ago and I still have symptoms. So it's very difficult to track the link. However, it's important to be aware of correlation, because if we were just talking about this and it was occasional kind of occurrence of the problems, then they wouldn't create a term for this condition. And also, this condition belongs to the category of rare sexual function issues. So I think it's quite important to be aware of potential effect of this drug on your sexual health if you are in some way connected to that. There was also one study done in terms of male fertility. So what they noticed is that men who had problems with fertility and were taking this drug, their sperm count increased after they stopped taking this drug. And men who didn't have problem with fertility and were taking this drug, it didn't really matter to them. So you see, the interesting thing is that if there is a weak spot in your body, then taking this drug might make it worse. If you're a healthy person, then maybe you wouldn't even notice any difference while taking this drug. But this is quite important to acknowledge. What else they noticed throughout additional researches is that men who never took this drug in their life had higher sexual performance in comparison to men who ever took these drugs. Also, under ultrasound scan, they also found out that men who were taking this drug had more problems with blood supply to their penis than men who never took this drug. And also men who had problems with emotional stability, they were more vulnerable to suicide while taking this drug than those men who didn't. So these kind of bits and pieces of information quite important to acknowledge, especially if you are affected at the moment. Recent research on finasteride also concluded that men who are taking this drug are more vulnerable to depression, anxiety, overwhelming catastrophizing thoughts, also insomnia, also inability to think clearly. Also, they are more vulnerable to suicidal thoughts. There were some studies that looked into the link between finasteride and mental health issues, and what they concluded is that younger men who are taking 1 milligram of finasteride are more vulnerable to depression, anxiety, and suicidal thoughts. And the interesting thing is that this was not noticed with older men who are taking finasteride, or men who are taking other drugs, for example, for prostate enlargement, like tamsulosin, or for hair loss, minoxidil. And then there was also a study that looked at the link between suicidal thoughts and sexual function. And what it concluded is that 9 out of 10 men who had suicidal thoughts also had persistent sexual function issues. There was also recent studies as per suicidal thoughts and mental health, and what they noticed is that those who take finasteride, they have much higher suicidal rate than those who don't. So we're talking about percentage as 21.2% versus 14%. In one study, 44.3% of people who took finasteride reported suicidal thoughts compared to just 3.45% in those who didn't use the drug. So as you can see, these are just statistics, just numbers, but they're quite concerning. Additional physical side effects of taking this drug could be muscle loss or weakening, enlargement of male breast tissue. Also, they noticed the change of energy levels, so men who are taking this drug would feel more tired and more exhausted than men who don't. Some people can develop problems with skin because of the oil production, so skin becomes dry, and there are negative changes in metabolism as well. Until now, researchers, scientists, and doctors do not fully understand why finasteride can cause long-term side effects. And this question still remains open. However, there are some theories why it might happen. Finasteride blocks an enzyme 5A reductase that turns testosterone into a much stronger hormone called dihydrotestosterone, DHT. DHT plays an essential role in male development and functioning, like sexual health, reproductive system, functioning of the brain, also sex drive, hair growth. So when levels of DHT are lowered by blocking the enzyme, then it helps with the hair growth and it helps with reducing the size of prostate. However, what doctors and scientists believe that it might interfere with other hormonal processes. So the researchers believe that side effects, unwanted side effects, could be caused by disruption of hormone processes on a long-term basis, even after the consumption of medication is stopped. Can also cause changes in how genes are expressed, can also overstimulate or alter hormone receptors, especially those involved with testosterone and DHT response, and it also can cause endocrine disruptor, so basically interfere with the normal hormonal balance. So the researchers believe that this might explain why some people experience long-term sexual, mental, and physical side effect after taking finasteride, and that is called Post-Finasteride Syndrome. And researchers found different genes related to hormones and brain chemicals and compared them to people who are taking finasteride and people who are not. And there is a tremendous difference in those genes. There was also a recent study that looked at penile tissue samples in order to understand why some people experience post-finasteride syndrome. It's still a study. There is no proof or evidence that these particular genes cause those symptoms in sexual function. Also, one of the studies concluded that finasteride interferes with the brain chemicals called neurosteroids that are there to regulate mood, stress, brain function, and that can also explain why people suffer from anxiety, from loss of sleep, and also from increased level of stress, and all these factors, they affect sexual activity, of course. And some studies show that men who are taking finasteride, they have breast enlargements, and that means that there is an interference with testosterone. So testosterone is converted into estradiol, or form of estrogen. So this kind of things are important to acknowledge, because if there wasn't a problem, nobody would look into it. But if there is a problem, it's important to look at all the possible causes of it. So what to do if you suddenly realized that you've been taking these medications for hair loss treatment or for prostate enlargement treatment, and you realized that there are some changes in your health, your psychological health, or your sexual health, or your physical health? The first thing is obviously to stop taking it. However, stopping this medication not necessarily will resolve your symptoms, because as you probably heard from my presentation, is that it's a long-term process, because if they interfere with internal biological and hormonal processes in your body, the changes could be for a long term and sometimes irreversible. But it's better to acknowledge the fact that it can be a strong impact, even though medical professionals don't always warn their patients about that, because some of them, they just don't know that these small studies, small researches exist. And some of them are not interested to know because they are more interested in promoting their medical services. First thing is basically to stop taking these medications. Also, there is an alternative. So, for example, if we talk about finasteride, changing oral consumption of finasteride to topical use, that is considered to be a much safer option. However, looking at the alternative ways of treatment of enlargement of prostate or hair loss, increasing level of testosterone through other ways rather than medically. And remember, any medication that you take for whatever reason would have some side effects. So it's very important to understand that there is not such a thing as magic pill in this world. There are always consequences in one or another way. But it's better to be aware and to know about the risks, know about your options, rather than make those choices that you will have to pay a very high price afterwards. I hope you enjoyed this video, and if you found it informative and useful, please do not forget to click like and also subscribe to my channel for more educational material.